That's everything set up. Okie dokie. Let's check this is running live. Guys, I'm going to start off today's live session talking a little bit about what causes sciatica, because the symptoms that a lot of you guys get in different areas of the body, buttocks, piriformis, down the leg, all these symptoms that we talk about as being sciatic symptoms are very confusing. And it often leads people to want to stretch endlessly the buttocks area, stretch the piriformis, get massage in the leg. And unfortunately, it's even more confusing for so many people because they don't actually have any back pains per se, right? They might have had back pain in the past, but right now, all of the symptoms are down in the leg, and it's been diagnosed either formally or otherwise as sciatica. And we're in this very confusing position with not really knowing what to do. And we try and do these stretches over and over again, and it really leads us down the incorrect path. A great cause of sciatica right here, user 2, 4, 8, 9, 6, and a bunch of other numbers. Can someone with a 7mm herniated disc avoid surgery and be pain-free? You certainly can. You've got to do your rehab though. You've got to do your rehab, and you need to understand this would be a good cause of sciatica, a very common cause of sciatica, some kind of disc herniation to the L5-S1 in particular, and the L4-5 segments in the lumbar spine. And what is happening here, and this is why, if, for example, in that case, we're struggling with symptoms down the leg, we're struggling with the symptoms of sciatica, maybe it's just some buttock pain, maybe it's back pain and pain going down the leg. We have to understand, especially with the question of surgery for sciatica, what is going on here. We have a disc bulge. This is a healthy disc, right? You can see that the nucleus stays in the middle, and it is the annulus fibrosus that is holding it in place. And therefore, if we have the herniation of some degree, this is obviously a bit more of an extreme example. What has happened here? Yes, we might have the disc bulge pressing on something, the herniation pressing on something, but in most cases, it's not actually directly contacting anything in any significant way. But we have a significant amount of damage to the annulus because it is the failure, the damage to the annulus that has allowed this bulging to take place. And so the surgical intervention might well remove that bulge, but it has done nothing for the healing. And so this is a valid source of sciatica, right? What do we have to do? We have to prioritize the actual injury that is down there in the lower lumbar spine. L4-5 and L5-S1, this one here, L4-5, these two greens, right? And then the segment, it's got a disc on the front, it's got facet joints on the back, and got a little hole where the nerve comes out at the side. And then we've got L5-S1, this one here, the green and the orange, right? And this is where the lumbar spine joins the sacrum. And we've got the little hole that comes out at the side here. There's tons of ligaments that protect and support these areas as well, right? That's very important. You don't get that on the spine here. And so the most important thing that you do is prioritize the injury. Negative gearing has said subluxation. Yeah, I don't know about that. But don't know about that. A subluxation, the medical definition is when a joint pops out and pops back in again. Subluxation in the chiropractic sense is used, well, to mean something different. So we can't compare those two things. I would suggest choosing the medical definition rather than the commentary of chiropractic speak personally. It's just helpful for clarity, if you know what I mean. And so if we're prioritizing the actual injury at the root cause of the sciatica, then we're going to do an awful lot more. Christy has said, can you heal it if there is already arthritis there? The great news is, for a lot of people, they have symptoms of sciatica, symptoms of back pain, etc., for maybe the last 6 weeks, 6 months, something like that, and they have symptoms of arthritis, i.e. symptoms of degenerative change that might be visible on the imaging. We've got some bony changes, right? You can see very clearly, you know, if we look at the healthy vertebra, right, and we look at the unhealthy, this would be, you know, degenerative change, right? The facet joints on the back are a bit enlarged, and it might be termed arthritis. What you need to understand is that arthritic change, that degenerative change that's visible on the images, was almost certainly there long before you had overt pain. Now, things can degrade over a long period of time, but it's important to understand that you have had the degenerative change there and you've not been in pain. So there's no reason you can't go through a full and complete recovery process to the point where you're not in pain again and you've built substantial resilience back into that lumbar spine. That is a very important thing to be aware of. Yeah, it's going to take some time. Yes, if you have degenerative change at specific sections of the spine. Only this last week, we were reviewing one of our members' x-rays and MRIs on the live session that we did yesterday. And you could very clearly see that through the MRI and through the x-ray, there was a lot of degenerative change through here, degradation of the discs, etc., more pronounced in the lower part of the lumbar spine. But up here, it was not. It was lovely, healthy, plump discs, nice and white on the MRI. and or light colored on the MRI. And so we had degenerative chain down here, but not up here. And that's an indication of how we've been misusing, perhaps, the body over an extended period of time and not creating good habits that support the health of that area of the lumbar spine, and instead, abusing it, quite frankly. But if we start turning that around and acknowledge that this problem has been building for a lot longer than we've had the overt symptoms, then we can do an awful lot better in the recovery side of things, because we're acknowledging that actually this isn't a problem that's only been there for the last 6 weeks that I've been in pain. It's actually been there longer. And so I need to rebuild. And then the question is, well, what part is healing, and when does healing stop and strengthening rebuild? Your role of your rehab, Christy and others, and all of you guys, right, is to rebuild strength. You're starting from a broken point, and then it's repairing, and then rebuilding, and it's very difficult to draw that line as to where repairing stops and strengthening starts, because fundamentally it's strengthening through the healing process right from day one. So something to think about. Just looking at the comments on here. Guys, if you guys have comments, post them in the comment section. If you're on YouTube watching this, by all means post them there in the comments. I'll try and go through these lives and go through the questions as much as possible to be as helpful as possible. I'll be going for about an hour, right? I'm going to finish in about 45 minutes or so, 50 minutes or so. So guys, just keep them rolling and I'll try and get through everything. What can be done for squaring of the vertebra, and is there always a cause? My daughter's 16. I think a little bit more information there for you would probably be necessary to help understand that a little bit better. The vertebra should be square, so we might be talking about things like shiny corner sign and stuff like that. I'm not sure. Can disc herniation reabsorb, and how common is it? A significant number of disc herniations or disc bulges, let's say, will reabsorb. Now, if you've got a sequestration, or an extrusion, which is where the material is gone, then what generally happens is the immune system will break down that stuff and process it. It's not going to just pop back in. Now, if you've got some minor bulges, then it moving back towards the center as we get, like this, for example, right? Moving back towards the center as healing takes place, I think is very reasonable. But can the segment heal? The most important thing that you guys need to think about is, can the annulus heal? That's what you want to happen. That's what will happen. That's what is trying to happen every single day when you have these disc herniations. And that's really the most important thing that you need to appreciate. Unfortunately, where we've lost nuclear material, if it's gone out of the bounds of the disc, then it's very likely to be processed by the immune system and removed. And it's not going to go back there. That doesn't mean you can't be well again. That doesn't mean you can't do extraordinary things again. That doesn't mean it needs to affect your life materially once you've done appropriate rehabilitation. And that's obviously the important caveat that needs to be done. You have to do the appropriate rehabilitation. I'm not sure what the context is there, Christy. I might have missed some of the comments on a few of my lower ones are showing black. Yeah, so that's with reference to the MRI. So it's very, very common. The L4-5 and the L5-S1, these root causes of sciatica in most cases, are often visible on the MRI as showing that graying out, darkening compared to the healthy discs. And that's just on a particular contrast on the MRI where fluid, water, shows up as white. That's why when you look at that line that goes along the back of the MRI, it's all white because that's the cerebrospinal fluid. It's just fluid, right? And so that's why you see the graying out of the discs as they become more and more dehydrated. And it's the maintenance and control of fluid in this space that gives that disc its height. That's what the job of the nucleus is. Annie has said, how to know you are good for running after L4-5 and L5-S1 disc herniation? Manny, running shouldn't be your target. Your target should be to use exercises like the squats and hip hinges to demonstrate the current loading capacity of the lumbar spine. And then how you get into running is obviously a strategic point, and you don't start just running distances. You might start for short, winnable distances. It might be for 60 seconds or something like that, right? Very important. Why do I say that? Because you need to know how healed you are, and how you feel is irrelevant. It's quite irrelevant, right? It's great you feel better as you make progress through the rehab, but the purpose of your rehab is to go, I'm doing a squat and I'm doing it with expert form, expert control, and I'm not aggravating myself. And I can only bear 7 kilos because 8 kilos, I tried it yesterday afternoon and it was too much for me. I couldn't do 10 reps. My back didn't like it. Okay? So I'm sticking on 7 for a little while, and then I'll test again 8, and then I'll stick on there for a little while, and then I'll test 9. And that's how you know. You know how strong, that's the only thing you can do. The only way you can know how healed you are is to pressure test the area. But you want to pressure test it in a safe and controlled environment. You don't want to say, I think my back's healed, I'll go and do a round of golf, and then find out it isn't. That's not smart. But if you're doing rehabilitation correctly and actually following a progressive rehabilitation plan, you have an understanding of how healed your disc is. And the question shouldn't be, how do I know when I'm good for running? It's a case of, how do I know how healed my back is? It's a function of your rehabilitation. So if you've gotten up to 40 kilos on the squat, great. You're certainly a lot better than you were when you were at 10 kilos or 20 kilos on the squat, for example. You've improved resilience, objectively speaking. And it would be pretty reasonable to suggest that actually getting into running at that kind of point would be a reasonable thing to do. But then it's the strategy again. The way in which we introduce loading to our members in the program is in the phase 2 of the program. And we suggest pick up something that is so ridiculous. So all of you guys watching right now are watching on a phone, most likely. Maybe some of you guys on YouTube are watching on the TV. But more or less all of you guys are watching on the telephone, which means you have the capacity to do a squat holding a phone. How much is the phone? Go and put it on the scales and measure it. Okay, it's 200 grams. Awesome. Okay, well, I can squat with 200 grams. Okay, try something ridiculous. We say this, it's a little bit silly, but you get the idea. So with the running, we specifically state, once you've made good progress on the rehab, we specifically state get to the kind of phase 4 level of the program, which is where we're using significant amounts of load. We've done that pressure testing work. Start out with short distances, 30 seconds. A minute, something like that, and do 2 or 3 sets of that. Something so silly, of course you're going to be able to manage it successfully because you've already done the rehab work and then go on from there. So hopefully that makes a little bit of sense. Focus more on your rehab. That gives you the answers. That's why we talk about it so often. Jeffrey has said, do you recommend some supplements for rehabilitation? The best thing you can do is focus on the rehab, then focus on your diet. Get enough protein on board on a daily basis. Cut out junk food. It's fairly obvious what that is. We shouldn't be having McDonald's and things like that for dinner. Fast food and other type things, microwave meals. Try and have fresh, real food, and meet your protein needs first. And then from there, you can go on and add other things, right? I take a collagen supplement and one that's got some glucosamine and chondroitin. I don't know if that's everybody's cup of tea. I think it's helpful for a lot of people. We recommend it, but I do not recommend it if you're not going to get the right source of nutrition from your diet. I notice a personal difference using it, more so actually when I don't use it for extended periods rather than when I do use it, which is quite interesting. If I run out of a bottle of it and then I'm training because of jiu-jitsu, my fingers get sore. And then I notice, oh God, they're sore all the time. And then I start taking it again. I'm like, oh, they don't hurt anymore. The training's the same, but the only thing that's changed is the supplement. So it must be doing something. But you've got to make sure you get your diet first. Supplements are the extra little tiny bit on top of everything else being right. You can't supplement yourself out of a bad diet. So make sure you're focusing on the basics first before we start adding extra expense via the way of supplements. Christy has said, how about if you did it 5 years ago? There's no difference, right? We've got members that come through the program that have done it 5 months ago. We very rarely get them that have done it 5 weeks ago. And more often it's a case of 5 months to 5 years to 10 years or longer. So it doesn't change what needs to be done, but your expectation of the problem, right? If you've had a problem in any facet of life and it's been there for 2 weeks, objectively speaking, then it's likely to involve less in the way of significant work to remedy that issue compared to if it's been there for 2 years. It's probably more stuff that's happened, more consequences. It's going to maybe take you longer to learn some of the things that you need to do because you've probably been doing them wrong for an extended period of time. And so that's all. It just helps you understand why maybe it takes you a little longer to get better compared to someone who's had it for a few weeks or a few days. So hopefully that makes sense, Christy. Guys, you guys on TikTok are throwing questions at me. It's awesome. I just try and keep up with them. What's my stance on PRP injections? So PRP injections are in the category of sort of biologics. They're in the category of regenerative medicine. And I think that makes sense, right? One of the big questions you guys should always ask yourself if you're having treatment, therapies, whatever it may be, right? For your back pain, for your sciatica, for your herniated discs, ask the practitioner this question. How is this helping me heal the underlying problem? How is this contributing to my recovery of the underlying problem? And maybe by extension, the symptoms as well. But if you fix the problem, the symptoms go away anyway. So we focus on the problem rather than just symptom alleviation because often that leads us into trouble. And so I think PRP on the surface of it is optimizing your healing process, supporting your healing process. If we contrast that with something like steroid injections or the common nerve blocks, how are they working? They are stopping your brain from feeling a problem. Doesn't sound like a good idea to me. Help the body work better, stop the body working. I'd probably choose the former rather than the latter. Now, admittedly, you could say that they are newer therapies, etc. There are a lot of people in the surgical space that suggest that actually injections are really quite unhelpful. More and more these days, I would suggest that seems to be the way things are going, but always discuss this with your surgeon. And I would suggest discussing this with your surgeon who's suggesting doing any sort of injection procedure is the right way to go. What do you think, doc, about stem cells? What do you think about PRPs? And what they'll probably say is something along the lines, well, there's not enough evidence. It's like, okay, well, explain to me how that might work and explain to me how the other one might work. And you get a sense, right? One quite clearly seems to be doing something for the better. The other seems to be doing something for the symptoms or trying to do something for the symptoms and stopping your body working. So I'm very for them, but I do think obviously you need to have a discussion with the relevant expert because they're not my expertise, right? I've got an educated understanding of them, but I don't do them. And so I would suggest they are something certainly worthy of looking into, and then go and speak to your relevant professional. We used to work with some guys alongside London Orthopaedic Clinic who started moving into the regenerative space, which is really cool, right? And so I'd be very happy to, hey, go and chat to the team, go and chat to the guys over there. They'll be able to help you with the regenerative medicine side of things, and that's awesome, right? I think it's a really positive thing, fundamentally. But again, if you're having regenerative medicine, that's going to help you heal. But if you're not doing the rehab work, it's going to be for naught, or it's going to be limited in its long-term benefit. Adam has said here, hello, my sciatica flares up only when I do McGill exercises. What does that mean? Do I need to stop until it settles down completely? I don't like some of the McGill exercises. There's a good chance that we're doing them incorrectly. And there's a whole host of different things. One of the most important and helpful things that you can do, right? Because people will get flare-ups when they do, for example, our exercises, things like the dead bug, things like a squat, a hip hinge, etc. Is that if you do them wrong, I know that those exercises we've chosen, we've put together in the updated program that was rolled out just gone this year, just gone September just now, 3 weeks ago, is like a culmination of significant experience, significant remodeling based on hundreds of consultation calls, based on thousands and thousands, if not tens of thousands of members' questions over the years, et cetera, right? And obviously all the over a decade of clinical experience as well. And so when you are supposed to do a dead bug, when you're supposed to do a squat, your spine should not move. If your spine moves, you often get pain, or rather, if you experience pain during that exercise or aggravation of the symptoms, because some of you are always in pain, and so we're looking at aggravation of that base level of pain. If you experience that during the exercise, we know you did it wrong. So you take a step back. Do I do an easier version? With some of the McGill ones, for example, the press down or curl down or something like that, where you put your hand behind your back and you press in and then you do some stuff, which is kind of maybe like trying to do a dead bug, for example. Well, number one, different people teach that differently. When McGill teaches it, he talks very much about supporting the lordosis, whereas I've seen many others teaching that from McGill, not emphasizing that and actually saying flatten the back into the ground. That's incorrect. So I don't know if you're going on that teaching. That could be a factor. The second thing, and I don't know why, but you'll notice my forearm is not straight. So if I'm using my forearm as a block, I'm twisting my spine. Probably not going to be that helpful. So I think that's a major oversight, or such a simple detail to have oversight on when we're thinking about using supporting the lumbar spine. We talk about using a rolled up towel. It's symmetrical, works perfectly, works very, very nice. So there's a number of different areas, Adam, but if you were doing our exercises, our spine stability exercises, and you're experiencing pain, which many people do, because it's not a foregone conclusion that you can actually do the exercise correctly. In fact, we probably assume that you can't, which is why we have detailed tutorials on how to do them and troubleshooting videos within the program, and why we have support in the program to help members get it right, because it's very likely that you can't do them correctly, or you won't do them correctly to start with. And then I'd say, which specific point of the repetition are you getting pain in? Not where the pain is, but where in the movement are you experiencing the pain? And it might be that you're actually just losing focus, it might be that you're losing engagement, and just a bit of care and attention to detail will make the change. Or it might be you're actually just not ready for that difficulty, so you try an easier version. So, for example, it might be that every time you do a squat, you get pain. So you go, okay, well, what about if I just go to here? Oh, then I don't get pain. Well, what's happening? When I go past this point, I start to lose my balance and round my lower back. So I'm being very obvious with you guys now, but that's an example of what often happens that leads to the pain. So something to bear in mind. Hopefully that helps, Adam. And if you need more help, guys, if any of you guys have been struggling for a long period of time with your back pain, with your sciatica, I would strongly suggest having a look at the program. There's a link up in the profile page, or for those of you guys on TikTok, for those of you guys on YouTube, I will paste it in the chat. You can go and check out. There's a nice video that explains everything and how it all works over on the website. You can check that out anytime. Fine has said, I like to crack my neck every so often. Does that affect my lower back? Not really, but it depends how you do it. I always remember a case of a young girl that came into the clinic and she had neck pain, and she said, yeah, whenever I get neck pain, I turn my head, and she grabbed a ponytail and yanked it. And I was like, goodness me, stop doing that. That is extreme. So it depends how you do it, but it's not really per se doing anything in particular, I would suggest. What else have we got here? So coming back into TikTok, questions. I have a lot of pain in my sacroiliac joint. Could this be a symptom of psoriatic arthritis? It could be, but we're going for a very extreme explanation of something that very plausibly is just mechanical lower back pain. You might also have psoriasis. You might also have psoriatic arthritis. But I would investigate for the psoriatic arthritis if you have cause to do so. But I would simultaneously also treat the back, like rehab the back. Often people, you know, you can have these things, and there are many forms of arthritis that are associated. You've got that as an example. You've got if I get the name right, enteropathic, I think it is, arthritis. So that is where we have things like ulcerative colitis and Crohn's, so abdominal issues that are associated with back pain, and a number of others. And yes, we can get those things investigated. We can do blood tests and things like that. They're in the category of seronegative arthropathies, if I'm recalling that correctly. Having to back into the memory bank a little bit there, guys. But like, irrespective of whether we have those or not, it's very likely that you have objective weaknesses in your back, lack of competence in your back, areas for significant improvement structurally in your back. And so I would never dream of saying don't look into those things, but don't fall into the mistake of doing nothing to improve the health of your back until you get an answer on the peculiar front, right? The more niche front, the more unlikely front. Because the simple fact of the matter is you could have those kind of things, you could have those other conditions, just like you could have a headache or a migraine and have a broken leg. You can have a headache and a migraine and have a bad back. Well, we don't wait till the migraine's fixed. Obviously, maybe in that scenario we do, but we don't stop dealing with the lower back just because we've got a migraine, right? Maybe that's not the best example, but you guys get the idea. There could be two things going on, a shoulder issue and a lower back issue. You don't need to stop dealing with anything with one of those. You can deal with both simultaneously. Georgia, I've got an L5-S1 disc, offered a nerve block injections in 2 weeks. You've got to ask the question, Georgia. What am I blocking? The awareness of the disc at L5-S1. Is that a good idea or not? I don't know. If you've had it for a long period of time and you keep on doing things that are making the disc worse, is the nerve block only going to help you continue to ignore the pain? Now, some people, unfortunately, the pain is the problem, right? When it wasn't that bad, it wasn't a problem, and now the pain is worse, it is a problem. And I would argue, unfortunately, we need to reevaluate how we view our reaction to what's going on in the body. If pain is the problem, well, quite frankly, because for so many people the pain is the problem, the injury isn't the problem, that's why you get the approaches that you get online and from your practitioners. Whenever you go to the specialist, sciatic pain is the problem, your back pain is the problem, the muscle spasm is the problem. And so that's why you have this whole approach that's focused on dealing with the pain. So why they recommend knee hugs, why they recommend injections, because you guys don't wake up in the morning and go, I really want to improve my back health. I don't have any back pain, but I'm going to improve the resilience of my lumbar spine. Because quite frankly, our lower back doesn't exist in our mind until it's injured. And it only exists in our mind when it's injured to a point where it inconveniences us from doing the daily life. So all too often we start off managing back pain by just taking painkillers or trying to avoid dealing with it, and going through it or something like that. And that's how we end up gravitating towards these kind of fix the pain. Okay, just have an injection to remove the pain and block the pain so I can't feel it anymore. Whereas if we take a step back and go, look, I've got a disc injury here. I've got something that's pretty bad. It's been going on for a long period of time and I've kind of been ignoring it. I haven't really been dealing with it. And I keep on taking pain medication so I can carry on doing stuff that objectively is making it worse. And an injection is just a more enhanced version of that. So maybe it's not necessary. Maybe I should take a step back and go, right, I'm experiencing significant amounts of pain on a daily basis, but actually I'm experiencing that because of the things I'm doing every day. And if I don't modify those things, when I remove the pain, I'm more able to do those bad things. So I use the example. The pain is like you're sat in the kitchen and the alarm is going off because you've left something on the stove and a fire has started. And you're like, God, there's that ringing in my ears and it's really starting to bother me because I'm trying to watch what's on the TV. And goodness me, I'm going to go and take the battery out of that alarm so it stops ringing in my ears, and that's the injection. That's the painkillers, right? And then I'm going to sit back and just relax and carry on watching what was on the television. And all the while, the problem is over here smoking. I'm allowed to let the problem go worse because now I can't hear the smoke alarm anymore because it was annoying me. And that is back pain and sciatic pain in a nutshell. And too many people go for that. And unfortunately, that's why the solutions are so much about pain. You don't go to see the doctor about your injured back. You go to see them about your back pain. Very important distinction. I know it sounds like pedantics, but you can see that if you go to see someone for your injured back, you're going to get a different set of solutions than if you go to someone for your back pain. Hopefully that makes sense. If there's any pushback on that, please do feel free to comment. and post down in the comments. I'll just have a quick look on TikTok, see if there's anything good coming in there as a result of that. Personal experience, nerve blocks are not worth it, Dan has said. I think many people feel like that, but some people leverage them and they find them helpful. There are always resolutions to manage pain holistically. Doing the rehab every day, but seeing no improvement. Spice latte, it depends on what you're doing. I don't know if you're following the program or not. I know you posted a number of times in here, but a lot of you guys, I know you do the core 5, right? We put a lot of information out on socials to help you guys. These live streams, we do the playlists that are on the profile pages and on the YouTube channel. And many of you guys have really good feedback. Like, oh, I'm doing the core 5, Mike, it's so good, it's so good. But actually, some of you guys need a bit more help. You need a bit more support. And so Spice Latte, in your particular scenario, for example, check out the program, right? Some of you guys will be able to do it on your own, but some of you guys will need that extra bit of support. So check out the program. Sign up, have a look at it, get started. And if you need help, then use the support in there. Upload videos in there. Engage with everything in there. Question, Spice Latte, for example. How many times in the last week when you've been doing your exercises have you recorded yourself and watched it back and compared it to the tutorial videos? And spotted for issues, errors. These are important things to do. The answer often is very few, from experience, if at all. RX has said, I had L5S on herniation. It took me 5 months to heal. Couldn't walk, stand. I can only lie on my side like a baby. And then one day the pain just went away. I've been back in the gym and all weird. Awesome. Glad you're doing good. By the way, I've been following the channel and doing the exercises and stretches you recommend. That might have had something to do with it, RX. But yeah, just keep going steady, steady. Your body's trying to heal every single day. And sometimes people do just wake up and they go, huh. Another time you're out for a meal with your friend or your family member or someone like that, and they go, hey, RX, you've been sat here for the last 10 minutes. You haven't once gestured about your back. Looks like you're doing better. What's happened? And then you go, oh yeah, I guess I am. I guess I haven't been bothered about my back as much. Often others notice it more, right? Faster than you do. Any tips for activating the hamstrings? Tegan, if you want to, I don't know precisely what we're talking about when we say activating the hamstrings, but you're going to utilize the hamstrings effectively if you are performing a hip hinge correctly. And a lot of people struggle to effectively work the hamstrings specifically because they are not able to hip hinge. And so any movements, for example, when they do a hamstring stretch, they just do that. That's all lower back, right? Rather than hip hinging and boom, now we've got the hamstring straight on. A lot of people really struggle with that. They really struggle with the hip hinge, which is one of the reasons why we're struggling to get better in the first instance. Simo has said, what about osteopaths? Can they help you with sciatica? I am an osteopath. Different osteopaths have different experiences, different expertises, different approaches. You have to understand that exactly the same as your chiropractor, as your physio, as your XYZ professional. They're going to do things in slightly different ways. The most important thing you can ask is, osteopath, how are you going to help me with my sciatica? That's the question that you ask. We explain to you guys how we do it, right? It's rehabilitation as the primary reason. We've got education. You have to be educated about your back, because if I do some great stuff, if you do it in, for example, the clinic on the decompression table behind me, behind that wall, or the laser in the other room, we do that great stuff, and then you go home and you just do a bunch of stuff that's going to undermine the good work we've done, you're going to have limited results. And then you think, oh, well, osteopathy didn't work. And it's like, well, not really. It's the fact that we did some good stuff, but it's not magic, right? And you can go and undo that by doing silly things afterwards. So education is vital. Over 60% of the program is education. I probably maybe even say more than that is the education. There's hundreds of videos, by the way. So you can imagine there's a lot that you probably don't know you don't know. Rehab is part of it, and then relief-based work is part of it. But often people, and this is education, focus on the relief-based work instead of the rehab work. And the rehab work is the stuff that gets you stronger. And if you're not progressing through that, you need to ask yourself why. And often it's that you're just not choosing to progress through it because you're waiting to feel better, and that's not how it works. You get better as a process of going through the rehabilitation. So that means as you progress through the rehab, you get better because you support that healing process. Happy to go into that into more detail, as I've done many times before, if there are any questions on it. Looking back through some more of these, what else have we got? Good point, thank you. Yeah, any practitioner should be able to explain how they are helping you. Very important. Gabriella is traveling to Thailand soon for a month. Got bad sciatica, any tips please? Get some real rehab work done as quickly as possible. The sorts of stuff that we talk about here. Educate yourself, that will tide you over while you are in Thailand. And build as much resilience as you can to help that lower back heal, which will be the root cause of the sciatica. And settle it down and build some strength. If you've got just about a month, soon, I don't know when soon is. I misread that as assuming that you were going in a month. but do as much as you can. If you need help, check out the link in the profile page, but you want to do exercises like the core 5, the stuff that we talk about in the program, that will help you rebuild and strengthen the back, protect the sciatica, and learn ways of doing things that help you continue to make that progress while you're away. Spice Latte said, what can you do in the pool to help? I think it depends where you're at, right? I think fundamentally, unless you've got a pool, assuming you don't have a pool in your garden, I think it's a waste of time going to the pool. And quite frankly, you know, going to the pool could be useful later on when you've made significant progress on the rehab, but if you're still not using squats or hip hinges with any kind of load, 5, 10 kilos, maybe that's all you're doing, but you're not up to something like 20 or 30 kilos, I think the actions of going to the pool, the stuff that you're going to do in order to get what you're going to go through to get to the pool is probably, you know, gonna just make it not worth it, quite honestly. And if you're willing to do all of that to get to the pool, why are we not doing our rehab work, right? Something to think about. Being in the pool, I think, you know, the best thing you can do in the pool is just float around, have a chat with a friend, right? Being in the pool is a lower gravity environment, which means it takes strain off these discs, which can be helpful, right? But if you have to go half an hour in the car across town, sitting down in the car, and then you got to get dressed, and then you got to get changed, and then this, that, the other, and you slip halfway along the pool because some kid ran in front of you, is that really worth it? Probably not. When you could have just stayed at home and done some other home-based rehabilitation, relief-based work, and then maybe go to the pool a little bit later on. So maybe later on we were in what we would call the phase 4 process, where we're actually adding in significant amounts of load to our exercises, and we might do a hard workout and then go and chill out in the pool afterwards to just unload the spine after a good workout. That might be a smart move, and that would make sense because at that point, we've actually built a good degree of resilience into our back, into our body, so that the action of going to the pool is significantly less strenuous than it once was. So something to think about there. Junior said, supplements help with healing a herniated disc. Just make sure you have a good, healthy diet. Eat enough food, get enough protein on board. I'd suggest that's going to be the best. You can take some collagen stuff, which is something that we recommend, but I hate saying that. I hate answering the question of supplements because it almost makes you guys feel like, oh, I'm going to go take a supplement to fix my back. It's like this much. It's like if you haven't got the other, like your rehab and your education, how you do your day, and I'd probably maybe throw in diet there as well, eating properly, eating well, eating healthily, getting enough protein, is like 90 to 95% of your recovery. Adding a supplement might be like 0.5% in terms of contributing to your recovery. But because I can take a supplement and boom, it's done, it makes it feel like, oh, it's good, you know? Focus on the basic stuff, the stuff that you can do. I do core strengthening exercises daily. I find they really help reduce pain. That's awesome. The hinging, not feeling them working. Hamstrings. Tegan, if you're doing hinging, so hip hinging, and you're not feeling the hamstrings working, then it suggests you're most likely bending rather than hinging. The difference here is quite important. A bend would be like so. Don't really feel much hamstring. I'm about the level of my knee. A hinge would be, boom, all hamstring. They are on, right? Very big difference. I've obviously done the worst and the best examples. More likely you're somewhere in the grey in the middle, and you're not the best. And you're not quite as bad as I did then, but that's where some of the leaking of movement. Basically, when you're failing to do a hinge, it's because you're allowing movement to leak out of the hip joint and into the lumbar spine as you're moving over, which is basically what a lot of people do and why they struggle. Because if every time you're bending with and rounding with the lower back, you're going to struggle to actually get better in any meaningful way because you keep on putting those discs under significant strain and it creates trouble. What else have we got here? Where are we? Guys, we've just gone past the halfway mark. So if you guys have any comments, questions, back pain, sciatica, that kind of stuff. We started today talking about fixing your sciatica, about the causes of sciatica, about the misconceptions around sciatica. So if you've got any questions on that, please do post them. And we'll carry on going through some of the Q&A. Turmeric helps reduce inflammation in the body too. Yep, turmeric is a common one that people will gravitate to. Thomas said, can I add in RDLs? Minor back pain, but have nerve symptoms due to a spondylolisthesis and a disc bulge. It's worth noting a spondylolisthesis is almost always going to come alongside, is going to involve having a disc bulge as well, because as soon as the spondylolisthesis, which is where it slides forwards, okay, as soon as that happens, the disc now is weight bearing in a atypical manner, in a way in which it is not designed to do, so the discs always become under strain. You need to be steady with the way in which you rebuild strength and resilience, but it's perfectly reasonable to get into RDLs. RDLs are a version of hip hinge, right? They're one in the same. It's just that calling it a hip hinge sounds a lot less scary than calling it a Romanian deadlift. That immediately invokes fear into the individual with back pain. So Tom, you have to learn to make sure that you master technique. Simple little things, right, that can help. When you're learning this at home, you stand in front of a chair with your hands on the chair, and you don't try and force yourself to go too far. You engage your core, hold everything nice and steady, engage your back muscles, and then you just go down slowly. Maybe run your hands along the side here. And if at any point you feel nervous, you just bend your knees and you catch yourself on the chair and you're good. Right? You might have the chair the other way round. You go down, you do your hip hinge, you feel, oh, I've lost it, oh, okay. But you catch yourself, right? It just allows you to do it in a way that is safer, that decreases the cost of failure. We don't want you in a heap on the floor. If you decide that you're first going to try hip hinges, you're going to go in the gym, grab a bunch of weight on the bar, that's going to be a problem. That's not a wise move. So practice refining the technique. This is one of the things that we get all of the members when they come through the program. This is what we do in phase 1. Get you guys to refine your technique with a as low a cost environment as possible. Can I do hip hinges like I'm skiing with my knees bent? When you're doing a hip hinge, there should be a slight bend in the knee. I don't think it's appropriate to be locked out like so and then doing a hip hinge. I think that's unwise, right? I think it just puts too much strain on the knee. What you're supposed to do ideally is have a slight bend in the knee. So a slight bend like so, as opposed to a lockout. And then just keep that knee joint roughly fixed. Yeah, it might move a little bit, but that's okay. We shouldn't be doing this kind of, then we're just doing a squat, right? Because a squat fundamentally has an element of hip hinge to it. J Manga. So hopefully that clarification, that demonstration makes a little bit of sense and helps clear up that particular point with regards to the hip hinges. They're such a vital move to learn. So important. I can't wait till TikTok have a Mac equivalent app so I don't have to keep scrolling on this tiny little phone. Can you heal a stage 4 degenerative disc? You're going to strengthen a stage 4 degenerative disc, but a significantly degenerative disc is never going to look like a healthy disc again. That's not going to happen. Nor does it need to for you to be well. Nor does it need to for you to be able to do pretty much anything you want to do. But you do need to acknowledge that the soft tissues have been degraded in their health and you need to go through the rehabilitation process to restore strength and stability, which you can do. It just takes time. Shay said, I just clicked on. It's hard to sit and bend. It's been a month now. I used to heal faster help. Oh, I used to heal faster help. Shay, you've got to do the rehab work, right? You've got an injury to the lower back. So just like if you sprained your ankle, if you hop on the ankle, it would hurt, right? You've injured your lower back. When you sit, you put more load through the lumbar spine, anywhere from 40 to 90% more load through the lumbar spine. When you bend, you significantly increase the load in the lumbar spine by changing the mechanics, straining this area. So basically you're saying, I've injured my lower back, and when I do stuff that puts more pressure on it, it hurts. Well, firstly, we need to actually be aware of the fact that that's what we're saying, right? That's really important. It's not a foregone conclusion. People don't realize that. You're not going to find a way of gaming the system, right? It's injured, it needs to heal. It's injured so it cannot load bear as effectively as it could when it wasn't injured. So anything that's going to increase the load on that area is going to be a problem until we have built load tolerance back again. And so how do we build load tolerance? That's your rehabilitation. That's the rehab work. That's what you need to do. You need to use exercises like the squats, the hip hinges in particular, to rebuild resilience into that lower back, to strengthen the tissues that have been damaged, that are currently intolerant to load. And over time, you will find you can do those things again. You'll find that sitting becomes painful after 10 minutes instead of 5. That sitting becomes painful after 20 minutes instead of 10 minutes, and so on and so forth. But that improvement in your symptoms comes from doing the rehab work. Your rehab takes your squat from body weight to 5 kilos, from body weight to 10 kilos, and you notice that those other things in the real world get easier. Very important. Secret Team has said, RDLs are really helping. This is hip hinges, for those of you not familiar. I feel so much more solid through my core, glutes, and hamstrings. It's working. Yes, it does. It's practice, it's practice, it's practice. And the nice thing about that is when the RDL is so much more ingrained, it's a grooved process. You just do it, and you just do it clinically, and you become like a robot. Every time you do it, it's just refined. And why is that important? Because as the Secret Team and all of you guys that are doing this kind of stuff correctly, as you get more proficient, more refined at that movement, it becomes safer and safer for you to use the hip hinge or the squat as your mechanism for exposing that injured section of the spine to that increasing load. That's why we choose these two exercises. And that's why we focus on technique first. When you're doing any rehabilitation, and I would argue this is exactly the same as if you were just getting into strength training without having any injury, you must first establish good technique. The more you practice good technique, not the more you practice good technique, because many of you, unfortunately, will have been practicing bad technique for many, many years. The more you practice good technique, the safer it gets to pressure test that good technique, and so build more strength with more good technique, and so we can continue to scale the process of adding more load, knowing that it is the safest possible way to do that, to get an objective understanding of how healed our discs are. That's what we're looking for. That's what your rehab is. And Shay, that's how you're going to find that you can heal those things again, or you can do those things again without as much pain. Tony said, I thought I had a disc bulge, but I have mechanical muscular issue and sciatic pain. I don't know what to say about that. Mechanical muscular issue with sciatic pain. That sounds like the kind of diagnosis you'd write when you're in the first year of university starting to see patients. Like you've just put a bunch of waffle. You've most likely injured your lumbar spine. It may not be a significant disc bulge, but it might well be there. The amount of times people have these MRIs and it's a minor disc bulge and they say, well, that's not causing your pain. It's like, no, pretend it is, pretend it is. And then when you pretend it is and you act as if it is, then you start to feel better, right? Muscle spasm doesn't cause sciatic pain. Something that is irritating the nerve in here has to cause sciatic pain, right? Very important. And so what can be injured here? Really, there's three things that can cause back pain, fundamentally, right? Either you injured the disc, either you injured the facet joint, or you injured the ligaments. It's pretty much that. That's pretty much it, right? We could say we had a significant fracture and break, but in the instance of that, you're going to also have those other tissues be damaged. Just like in the knee, right? In the knee joint, you've got the meniscus, you've got the other cartilage, the hyaline cartilage, and you've got the ligaments, and of which there are a number of different ligaments, right? That's all you can injure. There's nothing else there to injure, right? You've either injured the cartilage, the ligaments, or the meniscus, which is a funny type of cartilage, right? That's all you can injure. In my finger joint, right? I can injure the cartilage or the ligaments. Right? If I've injured the bone, then I've damaged the bone. I haven't damaged the joint, right? And in the process of damaging the bone, I've probably damaged the joint as well anyway. Like there's a limited number of things. Mechanical muscular issue is a bit of just jargon, I would add. Tony, I'd pretend it's a disc injury because that would explain the sciatic symptoms. I hope that makes sense. So often, Tony, that is the first diagnosis. The first diagnosis is you've got muscle spasm that's causing your sciatic pain. It's like, please explain to me how that works. Oh, well, it's tight. Why? Oh, well, it just is. Why? Because you've injured your lower back and it's sending signals to tell those muscles to tighten up. And that's making everything worse. But you've injured the segment. Disc, facet joints, ligaments. And quite frankly, the segment is probably where it needs to stop. You've injured the segment. Because I know I talk a lot about the discs, it helps you guys understand these things, and the discs are nearly always involved to some degree, shape or form, because of the way in which we use our body every day. Right? They're the primary load-bearing structure. They're the thing that's under strain most of the time. They're the thing that so frequently fails. But in the process of the disc failing, you have to understand that the facet joints will have failed in some way, shape or form and interfered with because they're not used to having a failed disc to work with. The ligaments that run between the segment will also be failed, which is why I think someone mentioned earlier on with the spondylolisthesis. The spondylolisthesis is such a good example because in the spondylolisthesis, it's always and obviously talked about that there is disc issue, there is facet joint issue, and there are ligament issues. So a couple of things to think about. I'm getting tingling sensations down in the lower back. One of the most important things to understand, guys, or one of the many important things to understand with your back pain is that the symptoms will vary significantly. But as those of you guys that have done some of these lives with me, you've seen, we got a notification on TikTok that we had 4,000 comments on the live sessions, and we've only been doing them for a little while now. And basically everybody has an L5S1 and an L45 back injury. Like all of you guys have that, like here. Why? Well, I've discussed that many times before. That's what we injure. All of you, right? Almost all of you. There might well be some L3-4 involved as well, and maybe sometimes there's a TL junction issue as well, and there's reasons for that. But primarily, most of you with the lower back pain and the sciatica, buttock pain, symptoms down the leg, it's down here. But you all have different types of symptoms. So the most important thing to understand is that You might have those other symptoms, and those symptoms might vary. As long as you don't have emergency red flag symptoms, don't worry about how the symptoms might change. Focus on the rehab. Very important. I can see you guys are having a little chat amongst yourselves in here, which is cool. What else have we got here? So just coming back through here, we've got my spine is poor, repair, daily exercises help. My physio hasn't helped either. I'm going to subscribe to the program. Awesome, spiced, yeah. Get involved, get stuck into the strategy stuff. It will help you. We will help you. What else have we got here? Back pain has got a lot better. I'm left with very bad sciatica. Any advice, please? Yeah, so we talk sometimes about this process of centralization. Centralization is where we have sciatic symptoms that then come back up and localize, and you end up with some lower back pain with the absence of sciatic symptoms, and then the lower back pain goes. Most people, a good number of people, most is probably not correct, a good number of people that have sciatica report, oh, well, I had really bad back pain a number of times, and then all of a sudden my back pain and I had sciatica. That is a worsening of the case. That means things have gotten worse. And then what generally happens if we do the right recovery work is that the sciatica starts to recede, and then we end up with centralization, which is where it goes back up the leg into the lower back. We have back pain, and then the back pain goes. That's a reasonably typical recovery plan of what happens, what you will notice as you go through the successful rehab. You should not be getting things going down the leg more. That is generally what leads people to then go and stop ignoring the back pain and actually start getting help. So David, you're fitting into a very classic example case. You need to get focused on the back rehab. It's very peculiar as well, because you're like, oh, well, there's nothing wrong with my back. It doesn't hurt anymore. It stopped hurting. It's like, yeah, that's the way these things sometimes go, right? In the cases of sciatica, it's not at all uncommon for people to have a lower back injury that is causing sciatica because it's hitting just the right nerves here. There's a lot of inflammation in the lower back, and they've just got symptoms down in the leg. Very, very common, very, very reasonable. Even though there's nothing wrong. The best example here is like if you hit your elbow here, your funny bone, and you get symptoms in the finger. There is nothing wrong with the finger. You hit the nerve here, right? It's just if you're constantly hitting that, you're going to constantly have the numbness in your fingers. And that's what's happening with the lower back. Tall Pork Chop has said, I need help bad. Guys, those of you that need help, do check out the program. There's a link up there in the profile page. Check it out. Watch the video there on that page. That'll give you a bit of information about how you can move forwards. Oscar said here, I did hamstrings 2 days ago, and my hamstrings are very tight and painful. Is it normal? Oscar, did you get involved in the hamstring curls and that kind of stuff? I imagine you probably did. And you've got a little bit of DOMS. And we're just not managing it as well. It is normal if you've just kicked it in. Oh, yeah, okay, Oscar, don't do kettlebell swings. Leave kettlebell swings out, please. Try and leave those out for the moment, or if you're doing them to demo for clients, please leave them at very, very light weights. I would strongly suggest getting your deadlift, or hip hinge, sorry, up to a higher level. I think you're on about 40 kilos from memory. I'd get it up to a higher level before I start messing around with kettlebell swings, to be completely honest. I mean, really, I'd say, try and avoid them unless you're doing body weight. Get your hip hinge up to around about body weight, i.e. your body weight on the bar, Oscar, for 10 reps before you start worrying about hip hinges. You've just got that extra variable of the hamstrings having to quickly decelerate as you go through that hip hinging motion, which is not the same as them having to do it slowly and controlled. So that makes sense why you're getting the DOMS, the delayed onset muscle soreness, and it's just something we need to manage a little bit better. So using the massage gun, doing some gentle stretching. Don't stretch too aggressively because that might irritate things a little bit more. Keeping a little bit mobile, that can help as well, and just allow them to go through that healing process. It sounds like we've just been hit pretty hard with the DOM stick, delayed onset muscle soreness, and it should settle down pretty quickly. But just try and steer clear of those kettlebell. I do think honestly that I think the kettlebell swings are actually really, really cool, a really good exercise. But it's just like knowing how to execute them and when to execute them, and I don't think they are part of a back recovery program. I think that they're just too advanced, right? I would stick them firmly over there in like really fun conditioning stuff to do. Maybe fun is the wrong word, but really fun conditioning work to do for a healthy individual to really strengthen and really refine that posterior chain, providing they have really good technique on things like a hip hinge, a squat, a deadlift, and those kind of things. I think they're a really good one. And you can do single arm to add that resistance to rotation, all that kind of stuff. But I would just be leaving them out for you as a rehab, while you're in the rehabilitation stages, let's say. Christian said, is it okay to use painkillers to make rehab feel easier? I would suggest probably not. And the reason I say that is it sounds like you'd be tempted to use them to lessen the feedback that you get from your exercises. And for most people, when they really take a step back, because often people will say, oh, the exercises hurt my back. And it's like, no, that's not happening. Specific parts of the exercise hurt your back, and we're not looking at it in enough detail. So get back in there and reevaluate precisely when we were doing this part of the exercise, at which point in the exercise did we experience pain, and then we'll explore why that is. Normally it's a breakdown of form, breakdown of control. We need to try an easier version. And to dull the sensitivity to those feedback mechanisms whilst you're early on in the recovery process, I think that's unwise, because I think it allows you to get away with substandard technique. Before I was doing very well, but I will try to avoid it, get proper healing. Can I use the cold foot? Yeah. Oscar, I would probably, just as a matter of course and safety, I would do some contrast bathing on the lower back specifically, and just step up your core relief work using some of the routines in the program. And maybe a bit of extra contrast bathing, but I wouldn't be putting that on the legs. If anything, I'd probably be doing some heat on the legs. If you've got access to the sauna, Oscar, that can really help optimize the recovery. So get in the sauna, do some stuff there, but just get some ice on the lower back after the sauna, because it's going to be great for the hamstrings and helping them recover, because they've been worked pretty hard, but it's not going to be so ideal for the lower back potentially. So just make sure you get a bit of ice on the lower back afterwards, just for a few minutes to bring the temperature down a little bit, and you should find you bounce back pretty quickly, but it'll take a couple of days to perhaps get over those DOMs. What else have we got here? Naomi has said, what have we said? I used to exercise 3 times a day. That's too much. Started feeling very good within 10 days, but then I started to go to the gym. My weight went from 5 to 10. I don't know what we're doing in the exercises 3 times a day. I started exercising only once a day in the gym, and the pain started to come back. It might be that you actually just, you need to be a little bit more active when you're not in the gym. You need to be more active when you're not in the gym, I would suggest. Because what often happens is our gym time might be the only time we actually are moving, and the rest of the time we just sat there doing quote unquote nothing or very little. And actually the action of you just going to the gym or doing the quote unquote exercise, even if it wasn't that intense, was actually quite good. So maybe go for a short walk, something like that. Work hard in one session, and then just be active. Don't be sat down all day. That's probably where the issues have arisen. And Naomi, if you're in the membership program, use some of the core relief work outside of those workouts. Work out once hard, and then use the relief work outside of that to continue progress, to keep active and help support that recovery process. I just feel it on my lower back too. Okay, yeah, so just use, Oscar, I'm assuming you're saying I'm just going to use the ice on your lower back. Yes, please just use it on your lower back. What have we got over here? TikTok. Whoa, that's quite a few messages. Okay, guys, what have we got here? Push-ups okay, L5S1 herniation. Wayne, focus on back rehab rather than push-ups. We can train the chest later, right? Focus on the back. I have pelvic tilt and disc bulges. Louise, I would always double check what you have. With regards to pelvic tilt. People often get told they have anterior pelvic tilt. We discussed this at length, right? Yesterday. So a great example yesterday on the live, one of the members, they'd had their MRI given and they got told they had a hyperextension at the LS junction. Not measured, but it looks like it's a bit too much. So we measure things so we can speak accurately. Turns out she had a flexion at the LS junction, not a hyperextension, because we measured it and we gave it a value, and the value was less than it should have been, which means it was an inflection. She had a posterior pelvic tilt. And so that's very, very important. If your comments on pelvic tilt, on lordosis, on alignment have been given to you based on physical examinations, ignore them completely, almost. If they've been based on an MRI, understand that they are extremely suspect in terms of they're very likely to be incorrect, right? And we saw that on the MRI, because we had the MRI next to the standing X-ray. The standing X-ray is the one that we're most interested in. Accurate measurements. Because how you lie down on the bench can lead to all sorts of changes in position. So just something to bear in mind there, Louise, sorry. And check out some of the, what was that last bit? Do they impact each other? It is very frequent, so in this particular case, for example, we have the one that I'm referencing yesterday. It is very common that we have a posterior pelvic tilt, a flattening of the lumbar curve. That's very normal, very common. Why? Because the average adult spends 9.5 hours a day sitting. What happens when you sit? You posterior pelvic tilt and load the discs. It is very common. That's why, because we flatten this lumbar curve, we strain the discs inappropriately, constantly through the day. in a way that's not ideal. Coupled with the fact that they're probably not very strong because they're not doing appropriate strengthening work, we then strain a vulnerable area. So it's very, very common, Louise. It's almost like, what was it? Can't think of an appropriate phrase, but it is very, very common. A lot of people will, if they have any sort of alignment issues, they will have a posterior pelvic tilt alongside a loss of lordosis with an L4-5 or L5-S1 disc herniation or damage of some degree. Very, very common. And that's, it makes sense when you look at how people use their body every day. What are the comments have we got in here? How do you tell the actual pelvic tilt MRI is done lying down? Yeah, Bradley, you do load-bearing x-rays. Load-bearing x-rays. That way you can measure it accurately. How many reps is too many reps for marching bridges, etc.? I just did 50. We typically do 5 sets of 10, guys. That's what we typically recommend. Once you get into what we would call phase 3 and 4 of the program, like it's load. The squats, the hip hinges, those are the things that are most important. You need to use those to build strength and stability. Not just doing reps upon reps upon reps upon reps upon reps is too much. Nomi has said one workout a day, not one exercise. One workout a day is what we normally recommend. Christian said, if you don't have dumbbells, are there any alternatives like bottles of water? Yeah, man, you can use whatever you want, right? Bottle of water. It depends on your budget, depends on what you want to do. A lot of people, so we talk about phase 2 in the program, which is where are we for time? Oh, guys, we're going to be wrapping this up in 5 minutes, okay? So any more questions, please do post those. In phase 2 of the program, we say, just pick up anything, right? Hold your phone, okay? Hold a mince, hold a water bottle. Just something to practice the choreography of holding something when you're doing the exercises. And then you're going to have to move on to weights. Christian, you're going to have to move on to weights sooner or later. You need to use something that's scalable. So it might be that you've got a set of adjustable dumbbells. It might be that you do it in the gym. It might be that you, Oscar, do the icing after driving. But you can use things like biofreeze. That can be quite helpful. And a little bit of hamstring stretching right before driving will just take the strain off the hamstrings a little bit to put the strain off the lower back. So yeah, you're going to have to get involved in using some element of load sooner or later, right? And it needs to be significant, or it needs to have the propensity to be significant. So it could be that you're using a weighted vest. Some of you guys might be able to see a weighted vest on here, right? This is a 20-kilo weighted vest. You might combine this with a 10-kilo dumbbell. We talk about targeting the amount of load that you want to be aiming for over time. That is what you're trying to do, build up this load tolerance of this. If you're not using any load, you can't build any load tolerance. And therefore, you're going to remain vulnerable. Even though you might well feel better, you will remain vulnerable because you haven't built any strength. Okay? And that's a very important point. So you're going to have to make a decision, Christian. A lot of this stuff you can do at home, but then you're going to get to a point where you're like, for me to continue this process, I've got to do one of two things. Either invest in a gym membership or I invest in having gym equipment at home. And you can do this for relatively inexpensive, right? If you're investing in the stuff at home, you might spend 500 to 1,000 pounds, right? And that sounds a lot for some. It's not a lot for others. But if you split that over 10 years that you will have this equipment, arguably 20 years, arguably a lifetime, it's next to nothing, right? We spend more than that on coffee every day, I imagine, for most of us. Not £1,000, but £1,000 split over 20 years is like next to nothing every day, like less 10p a day, a cent a day, something like that. Like it's an investment, but it's an investment in our health. And so, that's worthwhile, I would say. It'll pay back in spades. What else have we got here? So I'm going to finish with this important question. These are kind of two questions. How do I build strength when my back feels so weak? And then I'm still in pain, so when do I add weight into the hip hinges? So number one, most of you guys will be in pain every day because what you're doing every day is creating trouble, right? Your back will be weak, but you're still getting dressed in the morning. You're still going to the bathroom. You're still straining on the toilet. I'm using that as an obscene example, but there's a lot of strain involved in that scenario, depending on how constipated we might or might not be and how normal our bowel movements are. We are not in a good position when we're sat there, yet we are doing it every day. And that's why we have these two criteria of aggravation-free and correct choreography. Because some of you guys are going to be in pain all the time. So you have to find the right level, right? You can do, it might be that, for Louise, for example, she's struggling, right? So your squat might be this, holding onto a door frame. For others, it might be a squat with their body weight. For some, it's half reps. For others, they can go down lower. It's aggravation free, and that's why those exercises are chosen and why we have tutorials that allow you to scale them to all levels. My back's feeling very weak. Okay, so you do the dead bug. Oh, I can't do that, Mike, that's too scary. Okay, lie on the floor and engage your core. That's where you start. Oh, lying on the floor is a problem? Lie on the bed instead. You're not competent enough to get on the floor safely, so do it on the bed. There's always a way, there's always an easier version that any human being can do, no matter how bad or weak you are. The most important thing you can do, which is what we help members with in the early parts of the program, is find your right starting point, which is different for everybody. Everybody's weaker than someone else. The weakness is a relative term. And so you have to find where your right starting point is, and it might be holding onto your partner's hands while you're trying to do the squat. That might be where you start. It doesn't matter. All that matters is you actually find that safe point that you can perform aggravation-free reps. And you then realize that if you can only squat, holding onto your partner's hands to here, that is infinitely safer than you getting out of bed in the morning, yet you will still get out of bed, right? So you may as well learn how to do the squat, because at least you get a reward from doing that. You don't get a reward from getting out of bed in the morning. Obviously, we have to get out of bed, we have to do stuff, right? Most of the time, we're still going to work, in spite of the back. So why are we not doing rehab work that is careful, that is the safest stuff you do? It's the only time in your day that you're actually 100% focused on what you're doing. And so Spice Latte, and on YouTube, we've got No Name, has said, I have pain all the time. Great. That doesn't matter. That's why we say aggravation-free. So the question is, are you getting aggravation from that pain during that workout? And I don't mean great in a mean way. I mean it like, so what? It doesn't matter, okay? Because you're still doing things every single day with pain, while you're in pain, because your pain is all the time. So considering the fact that you're getting dressed in the morning, in pain, considering the fact that you get out of bed, in pain, considering the fact that you go to the toilet, in pain, considering the fact that you walk the dog, in pain, why not do something that's going to help you while you're in pain? But make sure while you're in pain that your aggravation doesn't get worse, right? So you will have had the scenario where you're in pain and then you go and reach for the bottle. Ow, now I'm in worse pain. Why? Because I have no ability to control my spine. My spine moves all over the shop, right? So wouldn't it be a good idea if you learned how to move without putting that spine in a vulnerable position? And yes, you might still be in pain while you're learning this. But then you learn, oh, okay, I'll move over here. Oh, and now I did the same thing without pain. A great example of this was the getting out of a chair. Oh, Mike, I'm in pain all the time. They're in the consultation room through the other room. I'm in pain all the time. When I get out of the chair, oh, it hurts my back. So bad. Okay, well, why are you doing that? Because that's not clever, right? So then you literally sit with them and you go, okay, right, we're going to do this. We're going to get the feet underneath us. We're going to engage our core, stand up straight, and then we're going to push straight up to the sky, maybe hands on our knees. Oh, wow, you fixed my back pain. It didn't hurt when I got out of the chair. We did nothing. We just taught you how to move in a way that doesn't provoke the injury. It's like the child that keeps on going, mummy, 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 my tires burst. Well, little Jimmy, why do you keep skidding your back wheel every time you brake? We keep fixing it and you keep breaking it again. What's going on, right? That's what you guys are doing with the back. So you may as well learn, sorry about TikTok there asking me questions. You need to learn how to do these things. And that's what then makes you safer through daily life, so that you can stop aggravating this every 5 minutes, so that it can go through a healing process, so that you can start to feel better. That's how rehab works. So, hopefully that's helpful. Oscar has asked a quick one on the single leg hip hinge, if I can do a normal hip hinge. I think the single leg hip hinge has some real value in stability. Oscar, that's why it's one of the few exercises we've added in. I think it gives you that extra layer of stability as you're going through that movement, holding the pelvis steady, coming through, really getting that balance, that proprioception, adding a little bit of extra stability to the equation. On top of the hip hinge, the regular hip hinge, which is very solid, right? It's got an extra trunk stabilization component, which I think is worthwhile, you building up your ability to do that. So guys, I hope that's been helpful. If you guys on TikTok need any more support, any more help, there's a link in the profile page. Check out the program, check out the link. There's a video there that explains more about the program, how we do things, the support, the structure, you know, the members area, all that kind of stuff. And if you've been struggling for a long time with your back pain, with your sciatica, some of you guys have commented today, check it out. You can join for a month and just stay as long as you need. It will help you. So thanks guys, thanks TikTok. See you next time. YouTube, I've just seen a couple more comments here. I'll just quickly cover them. ZZ has said, when can I start riding a bike post-disc extrusion? It's been 3 months since January. No back pain, just a stretchy feeling in the buttock. Guys, this is the most important thing. Those of you on YouTube, I'll just stay for a touch longer. So if there's any questions, you can post them in sooner rather than later, but I'm gonna have to wrap it up reasonably soon. It's not about how you feel. ZZ, you need to do rehab. You need to do strengthening. That's what gives you understanding of how strong your back is or isn't. Getting into cycling involves you sitting in this position, like so, right? Your main focus should be rebuild strength and stability. If you're still struggling to effectively do a hip hinge, effectively perform a squat, performing those with any small amount of loading, 5 kilos, 10 kilos, whatever it may be, you're struggling with that, get that right first before worrying about doing those extra bits and pieces. And black feathers still, as a supermarket, is the worst. Walking, bending, twisting, yeah, you know, you feel like a little bit of a robot. But, you know, we have to do it because we have to eat, right? Maybe you can get a delivery done, maybe that'll work. But you've got to do many things, and many of those things are problematic while we're recovering from back pain. If you focus on the rehab, do the best you can with daily life, and leverage relief-based practices like those that we talk about in the program, then you will be able to get better. So that's been helpful, guys. Thanks for joining on YouTube, and we'll see you next time. Take care, guys.